If you have a child that suffers from ADHD or know someone whose child has been diagnosed with ADHD, they may have a sleep disorder. Our next guest says the reason being, unlike adults who feel fatigued, children often become hyperactive and irritable. Dr. Patel is here to tell us a lot more about sleep disorders in kids. And you know what, Dr. Patel, the thought never occurred to me that children would have sleep disorders. How do you know that your child has a sleep disorder?
Well, that's a very good question. Most parents would think that a child, if they're not sleeping well, would be tired, sleepy, fatigued. Oftentimes, children don't even complain of anything, so you kind of have to just observe them and see how they're feeling. But in terms of children themselves, when they are sleep deprived from whatever cause it may be, even if the parents are not allowing the child to sleep enough hours per night, the child will oftentimes be very hyperactive. They'll have poor school performance. They can be very irritable. They become the opposite of what we would as adults when we're not sleeping well. So that's a big sign right there. And many of these children are unfortunately labeled with ADHD, and they're prescribed stimulant medications, which are amphetamine salts, which are, strong medications, potentially dangerous.
Right.
When in fact these kids may not even need it. It's possibly an underlying sleep issue that, if it's corrected, can lead to improvements in these symptoms.
Wow, so it really comes down to the right diagnosis then for that child. So if a parent, just some of those symptoms that you were just explaining to us, they're seeing their child exhibit that, what should they do?
Well, they should speak to their pediatrician, of course, and see, is there a concern for underlying sleep disorder? I mean, the sleep disorders that commonly affect children are very similar to the ones that affect adults. I mean, children can have pediatric sleep apnea. They can have restless leg syndrome. There's another condition that occurs when a child is sleeping where they kick their legs while they're asleep, and actually causes their brains to wake up excessively, and in turn causes them to sleep less than what they should, and that can result in symptoms of ADD or ADHD, hyperactivity. So things like that would be something to look out for. If a child snores, that's abnormal. A child should not snore. So that right there would be a big indicator for us in sleep medicine that possibly the child has sleep apnea.
Wow, I never even thought that a child could get sleep apnea, but apparently so. And because they're young, I mean, their bodies are growing. I mean, sleep is so important to them. At what point when they really should see a sleep specialist, and what can you do to help them?
Well, if there's any concerns in terms of a child, if a parent's concerned that my child is hyperactive and irritable, they really should see a sleep specialist.
I think every parent could pretty much say that, though.
Yeah, I agree.
But you're talking, really over the top.
Absolutely,
right.
Absolutely. I mean, if there's any concern at all that the child complains, I'm having headaches in the morning, or I feel tired, or if the child is just unusually tired during the day, say they fall asleep on the ride home from school. Those would be other sort of subtle signs right there that maybe they're not sleeping as well as they should be. But in terms of evaluation, so it depends. I mean, when I see a child in my clinic, I sit with the parent and the child and kind of get a history to determine, what exactly is going on. Was there any sort of developmental history that could have led to changes in sleep?
Would you be looking for possibly maybe some records then from the pediatrician too, to just kind of help you kind of get a full history?
Of course. Yeah, just like an adult. I mean, it's always important to have all the other information to kind of piece everything together.
Absolutely. Wow, really good information, and something for parents to really think about. If your child is exhibiting any of those symptoms, they could have a sleep disorder. Well, this Insomnia and Sleep Institute of Arizona, here's where they're located. It's 8330 East Hartford Drive. That's Suite 100. They are located in Scottsdale. For more information, you can call them at 480-745-3547. You can also visit their website, sleeplessinarizona.com. Thank you, Dr. Patel.